Hey Nicole, we're going to get started here. My name is Rory Conley, and I'm an NP student at the University of North Dakota. I'm here today with Corey Stedgy, and this is our third and final video for 585. Today we're going to do a preoperative ACL examination. Apologize for kind of how this thing is set. We're trying to get everything all in the appropriate media. Start off by a little bit of hand hygiene before I work with the patient. I'm going to break this down to basically three different things when doing this examination. I'm not used to doing a preoperative examination working inpatient in mental health. This is something that's somewhat new for me, but I kind of have broken down into three parts. Number one is going to be about kind of the preoperative questioning, kind of the general questions you ask somebody before you go in and have surgery. Number two is just a general assessment of the patient themselves. And the last part is going to be a specific assessment of the extremity that we'll be working on. So starting off with that first part, I'm going to ask Corey some very generalized questions about his health history that are important for somebody who may be going into surgery. So Corey, have you had any medical concerns recently that you care to share at all?
No.
Okay. And then your ACL, we'll say maybe you hurt it going snowboarding or something like that. I'm going to ask him questions like, are you currently on any medications? No. If it's a female, we might talk about birth control. I'm going to also do a set of labs on Corey. I want to see how his liver and kidneys are functioning. Just kind of look at some of those general things. I do have a concern, with things like antibiotics, with narcotics, to make sure that the patient can tolerate those meds, or maybe he's got like a sulfa allergy we may not know about, or maybe he's got some kidney issues or some that may prevent from having anesthesia when doing this. So I'm also going to just do a general set of labs. Vital signs is another thing that I'm going to do. We're not going to do them here. And that kind of, with some of that pre-planning, that first step, I'll go to my next step, which is just a general assessment. When it comes to the general assessment, I'm not going to get too super on the weeds on anything. I just want to kind of do a general overview to make sure the patient positioning of the patient is all right. So I'm going to first kind of start off with the patient's head, ears, nose and throat region, and just kind of give a general view and assessment to see if there's any deformities, bumps, kind of anything like that. Being on the table for a long time to have surgery, you can have issues with skin breakdown, skin tears, especially people like diabetes. So I want to make sure to see if there's any pressure points or fragile skin that can have any issues with that. Also, things with hearing, smelling, anesthesia does things to different people. So, Corey, do you have any problems hearing?
No.
Any problems breathing through your nose?
No.
Any problems breathing through your mouth?
No.
Any problems swallowing?
No.
Okay. I'm going to get one of... check his ears out really quick. Okay, looks good. On this side too. Okay, looks good. Pop this part off. Can you tilt your head back for me, please? Open up your nose. Okay, looks good. Open your mouth for me. All right, stick your tongue out. Okay, can you lift your throat up? Okay, swallow. Okay, very good. Can you, big smile for me? Shrug your shoulders. Okay, make eye contact with me. Can you feel this?
Yep.
Okay, can you feel this?
Yep.
Okay, very good. So kind of starting off with that section, we'll keep working down. I'd ask Corey if he had any skin breakdown or skin issues. Would also look at his backside too, because that's hard for some patients to look at to see if there's any fragile skin. From there, I'll move to the cardiac, the respiratory, and then his GI section. Corey, do you have any issues breathing?
Nope.
Do you have asthma, COPD?
Nope.
Nope. Have you ever had any heart issues or?
Nope.
Nope. You do realize that probably when we're doing this, we'll be doing an ECG or a 5 lead of your heart where you're going in.
Mm-hmm.
Again, he's not on any medications. We have to worry about heart stuff. So I'm just going to listen to the 6 fields of his lungs, and then at the 5 points, and then I'll listen to the 4 quadrants of his stomach. So I'm just going to do that really quickly. Corey, can you lean forward for me, please? Okay, deep breath. Deep breath. Deep breath. Deep breath. Another one. Another one. Okay, deep breaths on the front side too. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, I'm going to listen to the heart. And I'm going to listen to the stomach. Okay. Corey, can you grab my fingers, please? Give them a squeeze. Okay, put your arms out straight for me. Very good. Push up. Push down. I'm just checking for overall strength and balance. That's kind of my general non-leg portion of the assessment. Now we're going to do more of the leg part of the assessment. It looks like his affected extremity is his right leg. Hopefully you can kind of see that, Corey, if we could just maybe move that over a little bit. So I'm basically, first thing I'm going to do is check like CMS sensation, kind of that vascular neural piece of both of his legs. I'm going to decide if there's enough swelling or we can maybe get an MRI at this time of his affected leg. If not, we can double check the strengths. So Corey, were you able to walk in here today?
Yes.
Okay, was it hard to walk in here?
Yes.
Can you put a lot of weight on your right leg?
Not without pain.
Okay, so first thing I'm going to assess this leg right here. We'll just kind of have Corey, you put it right here. So I'm going to have you, can you push up, please? Okay, push down like you're driving a car. Okay, I can notice that there is some strength differences between each of them. Can you move them side to side for me, please? Okay, very good. And Corey, can you lift both legs off the chair for me best you can? Okay. So what Corey was meant to do was lift this one up and have a hard time lifting this. Can you bend them both for me, please, Corey? Okay, so there's a notable strength difference between both legs. So the next thing I'm going to look at CMS. He's got his combat boot on, but how about we say that the pulses are a +3 right there. Cap refill is less than 3 seconds. Same thing on this leg right here too. We're going to look at cap refill, CMS, cap refill, pulses. We can definitely feel that. Corey, is there any numbness or tingling in this leg right now?
No.
Okay. We don't see that there's much swelling here, so we might want to do an MRI after that too. And again, we're also looking for skin breakdown, especially on those heels. A couple tests we can do to test ACL or test the knee. We can check the Blotman test to see, move around here, to see if there's any fluid in that knee. So I'm going to press right here first. If I hear clicks or he's in any pain, that'll know that there might be a little bit of extra edematous fluid there. Next up, we want to do the bulge sign, which is we're going to milk. You could bend this for me here, or keep it flat for me, please. And we're just going to milk the side of it and tap the inside of the knee. Same thing, we're looking for new pain, clicks, anything like that. We're going to put his knee at 45 to 90 degrees right here, and we're checking to see how the meniscus is doing. We're going to try to rotate it out and see if there's, again, same thing, clicks, pain, edema, any of that stuff. The two big ACL ones is one's the shelf test and one is called the Lockman's test. So the shelf test will be, this is kind of a newer one for me. We're going to put the knee right about here, keeping his heel down right here, and then I'm going to try to push the tibia and it should feel like it's almost like opening and closing a drawer. Again, we're not going to get much effect here because Corey's ACL is intact here. So the last test we can do to just double check ACL is Lockman test. I'm trying to get a good position here. Lockman test is pretty much rotating the leg and trying to separate the femur and the tibia from each other to see if there's any play or movement. 5 millimeters should be kind of the distance there. So in a nutshell, some post-operative teaching we want to do. We're going to be giving pain meds. Patient's going to have a brace, so we'll need to do some teaching on that. We'll want to think about like antibiotic. Usually when the patient's under the table, they'll get their antibiotics. And then we also want to think about like stool softeners. Corey's not used to taking narcotics, so he'd want a stool softener when he's doing that. So in a general nutshell, that is the Rory Conley ACL preoperative exam test. Nicole, I hope you like it. Thumbs up. So, thank you.